salvation. The iron, for example, at the therapy iron man, then yeah, I just tell the patient to stop the open, and I overnight the yellow toe, or I send the patient to the pharmacy window so they can the yellow toe next day the same schedule they are taking warfarin. So when I know that I'm therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the yellow toe tomorrow. And I know the patient will receive the medication at the window, or you have the patient tomorrow via the overnight. And how about if the iron not too, if it's too low, then I would just say take half the warfarin to the next day in the sense of warfarin. What happens if the iron not too or 3.5 or 4 or or about 3. So if it is about then I will stop the bed, and then go ahead and take to the next day. If it's 3.5, then I might stop for 2 days, trying to take Eroto. If it's 3.6 or 4, and stop the Eroto for 2 to 3 days. But if it's more than 4, then I'll to hold the dose and I have the patient to come, here. But I don't. It's above 4, and I have to have the patient to reject the I9. Switch from a warfarin photo. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. by about 300, more than 300 results from this research. But the top few websites have some very important information for you. Say converting to converting the eloquence of this event. It's open and start this event 3 days later. So correct, but the different level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay, and the normal warfarin is usually below 0.9 or 0.9. So around that level, no warfarin. The people, the warfarin. But how about if the warfarin level at that time at the baseline very high, like 0.2, meaning 1.2 or 1 like that, and you may stop maybe this or so. And then the second option that this event and then the parenteral anticoagulant or the injection. So, like, and then warfarin at the same time. So, for some people, they are very high risk of stroke or of complicated situation. So you need to make sure that not have any life-threatening. So okay, if you want to switch to warfarin, then you probably need to make sure warfarin at a therapeutic because it takes about 3 to 5 days in order to make sure you get into the therapeutic level. In order to make sure that have some form of like low enough injection to make sure it's not risk for dangerous blood clot. So that's when you switching from eloquent to but you need to have the and then based on that you may need to stop the eloquent. Maybe if you have no line, if you have high baseline to stop the eloquent, it'll be should. And if you have a very high risk of dangerous blood clot, you need to make sure that you have some form of like low enough injection and therapeutic stop the low enough injection to the patient having stroke of the blood clot in their lungs. Thank you. How to high my results right here convert types or this quickly level yes my sorry I know before you start everything later it higher to and in risk. you know, you need to make sure if the patient is very high risk of the blood clot, like acute blood clot. They just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not be the INR should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the injection, like Lovenox injection. So for that case, yeah, you need to stop the Eliquis and then start the warfarin and the Lovenox together. To start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the INA to make sure the INA levels is at therapeutic, between 2 and 3 or so, and then stop the Lovenox injection and just continue to take a warfarin along. So that's the case that you need to make sure that you how to switch from warfarin to Eliquis. So you can go to Google and type switching from warfarin to Eliquis or Adixaban. You can find about 400,000 results. But the first few websites help you to understanding how to switch from warfarin to Eliquis or other direct acting oral anticoagulations. So for Eliquis, we'll switch to the Eliquis when the INR are less than 2. So, excuse me. So, for example, if the patient INR is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquis. So, at that time I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquis from warfarin. And so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the INR to make sure it's less than 2 before start taking the Eliquis. It's more easier for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the INR at the therapeutic level, and then start the Eliquis to make sure the INR less than 2. If the INR a little bit high, like 3.2 or 3.3, then I would recommend to stop the warfarin for 3 days prior to starting Eliquis. But what happens if the INR at the really high, like 3.6 or above in the time visit? Then I would recommend I would reduce the dose or take up a partial dose and then retest INR in 1 week to make sure INR level therapeutic before switching to the Eliquis. And when the INR at the therapeutic level, and just try to hold 1 or 2 days prior to the Eliquis, prior to starting the Eliquis to make sure the INR is. The COVID-19 caused VTE, the venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 caused VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. So, and then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, BostonMedicalJournal.com, is also show that the patient with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients who have the COVID-19 vaccine, and they are the input of the INA. So the COVID-19 vaccines might increase the INA number. It's not much. It's about between 0.1. For example, people who normally have INA around 2.5, they may increase the INA to 3.0 to 3.5 after vaccination. But it's not used to the INA increase in about 3 to 4 weeks. And after that, they back to the normal target. normal range. So in those 3 to 4 weeks, the patient who have increased the INR due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that not out range, not super therapeutic. So yes, some certain whether or not the COVID-19 vaccine affect the INR level or not. Yes, they
avoid production or the bigger trend. If you are allergic to production, you should avoid production for some indication, such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid production if you are taking rifampin, St. John's wort, because this medication may reduce your production effect. You should avoid production if you are taking verapamil, quinidine, azithromycin, clarithromycin, erythromycin, itraconazole, ketoconazole. This medication may increase your production effect. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter when you taking production. Some over the counter like Motrin or aspirin might increase risk of bleeding when you take with production. So make sure you let your doctor or your pharmacist know when you are. You should avoid production if you have major and ongoing bleeding with production. You should not use production for blood clots due to anti-cancer. Typically, for people who have blood clot related to active cancer, they should take warfarin or Lovenox instead. You should check with your doctor who manages your blood thinner medication or the anticoagulation clinic for further instruction. Please let me know if you have any questions in the comment box below. Thank you. Avoid erythritol or rivaroxaban if you are allergic to erythritol. You should not use erythritol for some indication such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid erythritol if you are taking rifampin, rifadine, carbamazepine, phenytoin, because this medication may reduce your erythritol effect. You should avoid erythritol if you are taking ketoconazole, itraconazole, ritonavir, because this medication may increase erythritol effect. You should check with your pharmacist or your doctor for any other medication to make sure there is no drug interactions between erythritol and prescribed medication or over the counter. such as Motrin or aspirin. You should avoid Geroto if you are having major and ongoing bleeding with Geroto. You should not use Geroto if you have blood clots due to active cancer. This is just for your general information. You should check with your doctor or your pharmacist if you have any further questions. Please let me know if you have any question in the comment box below. Thank you. Avoid Eliquis or Abicibane if you are allergic to Eliquis. You should not use Eliquis for indications such as for indication like antiphospholipid antibody syndrome or mechanical heart valve. You should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce the Eliquis effect. You should avoid Eliquis if you are taking ketoconazole, itraconazole, ritonavir. This medication may increase the Eliquis effect. If you have to take ketoconazole, itraconazole, or ritonavir, you may have to reduce the Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with the Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or diclofenac instead. This is for your general information. You should check with your doctor who manages your blood thinner medication, your anticoagulant for further instruction. If you have any question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. The opioid effect, it gives you a good feeling like high, so to continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs, such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioid is for oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer, Voodoo Pharma. A lot of people will die because of the OxyContin long extended relief effects overdose. The manufacturers had
to file a bankruptcy, and now it renamed as Norpharma. So when the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the OxyContin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. Legal opioids keeps an opioids. Illegal opioids, including heroin or cocaine. Non-opioid drugs, such as marijuana, methaqualone. Marijuana may be legal in some states, and the prescription opioids, including OxyContin or oxycodone. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids, including OxyContin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, Diuretic, Soma, before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured from China, and then it gets into the United States via the Mexico border. People who have the heroin or OxyContin addiction or dependence, they start using the fentanyl. Maybe more convenient, and it may be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2,000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligrams. So one tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methadone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease may be an arthritis. For example, arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid abuse might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect or the OxyContin effect, they give you a good feeling like high, So to continue having that feeling, it means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side. I use non-opioid pain relief medication, Tylenol, Motrin, when you have pain symptoms instead of the. If you have any further question, please let me know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. But that's very rare. Sometimes people have AFib, but they don't start the platinum medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the platinum medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor need to select one of the oral platinum medication. If your AFib is not regular, you may start with the Eliquis, Geroto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, then your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. Protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. Protein C or protein S deficiency treatment duration. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. So for this medication, I think there are ongoing studies. Antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further questions, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is my single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you might need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing study for the other medications such as Alaquip, Geroto, Adaxa for this indication. If you have any further question, please let me know in the comment box below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Alaquip, Geroto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic mitral valve disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism, or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the blood clot, you may only need to take a blood thinner medication for about 3 to 6 months. If that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you have to take a blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication until you no longer have cancer, and at least for 3 to 6 months. So you have to take a blood thinner medication at least for 3 to 6 months and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? You have to take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know what is the cause of the blood clot in your leg, then you might need to take 6 to 12 months if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral heart valve treatment duration. If you have mechanical mitral heart valve, you may need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment period and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack, TIA, or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further questions, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a platinum medication indefinitely for the rest of your life. The best medication is bioprosthetic aortic heart valve or tissue aortic heart valve. Then you may need to take a platinum medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a platinum medication. You have aortic heart valve. Your cardiologist will tell you exactly how long you have to be on a platinum medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and platinum medication treatment duration. So if you have a stroke and you have to take a platinum medication, you know how long you have to be on a platinum medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a platinum medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a platinum medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a platinum medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, you take a platinum medication. The best medication, the best platinum medication is warfarin. So if you have a history of dilated cardiomyopathy and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a platinum medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy, and now you have a left ventricular thrombus, then you may need to take a platinum medication for at least 3 months. The best platinum medication is warfarin. You should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further questions, please let me know in the comment box below. Thank you. prior to pacemaker or defibrillator placement. What should you do if you are taking warfarin, Eliquis, Geroto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. However, you should recheck your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, and make sure you follow your doctor who manage your warfarin or the anticoagulant to hold your warfarin or adjust your warfarin dose to make sure it is therapeutic or at the goal level before the procedure. If you are taking Eliquis, Geroto, or Badaxa, you should check your kidney function to make sure you don't have any bleeding complication from the procedure. You should continue to take the Eliquis, Geroto, or Badaxa, otherwise as indicated, instructed by your surgeon or proceduralist. If you have any question or concern for me, please let me know in the comment box below. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medication such as warfarin, Eliquis, Geroto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. If your warfarin is therapeutic, if your INR is elevated or critical, then you should recheck your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Eliquis, Geroto, or Badaxa, you should check your kidney function. Do not hold unless otherwise as indicated. You should follow your surgeon or proceduralist instruction. If you have any further question or concern before this procedure, please let me know in the comment box below. Thank you. What should you do prior to lung biopsy procedure if you are taking medication such as warfarin, Eliquis, Geroto, or Badaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you had a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to a procedure. If you have to hold your warfarin for more than 3 days, you should reach with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulant for breaching instruction. If you have to take the Eliquis, Geroto, or Badaxa, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater, then you may only need to hold your Eliquis, Geroto, or Badaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Eliquis, Geroto, or Badaxa for more than 2 days. When you hold for more than 2 days, then you may need to delay to resume your Eliquis, Geroto, or Badaxa. You should follow your surgeon or proceduralist to resume your blood thinner medication. Any question, you should check with your doctor who managed your blood thinner medication or your anti-coag clinic. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is therapeutic and your INR history is stable, then for 4 to 5 days prior to the procedure. If your INR is critical or elevated, your doctor who manages your warfarin or your anti-coag clinic might need to hold your warfarin or reduce your warfarin dose and recheck your INR in about 1 week to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then be rich with your low injections to prevent from having recurrent blood clot or stroke. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. If the creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, Badaxa for more than 2 days prior to the procedure. If creatinine clearance greater than 50, then you only need to hold your Eliquis, Xarelto, or Badaxa for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor or the anti-coag clinic instruction. You should resume your blood thinner medication as instructed by your surgeon or procedure list. If you have any further questions, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Xarelto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to reach with the low injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency, If you are taking the Lovenox injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulating instruction closely. Make sure you understand when you need to start the Lovenox injection, when you need to stop the Lovenox injection before surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenox injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the updated lab. They should get the updated lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manages your warfarin, your anticoagulant. If you have any further questions, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result fixed, then hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have very elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range before you can plan procedure. So you should follow your doctor who manages your warfarin or anticoagulant closely to you have a appropriate plan for surgery. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider switching with the Lovenox injection if you have a history of recurrent blood clot or stroke, and risk factors of having blood clot or stroke, such as uh, factor 5 deficiency or some kind of genetic. If you have to risk with the lower injection, you need to follow your doctor or the anticoagulation clinic closely to make sure you understand when you need to start overnight injection, when to stop overnight injection for the surgery, and when to resume your overnight injection after the procedure, when completely stop the overnight injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more update labs than the normal people. If your kidney normal limits, then you should hold for 2 days. If the readherence not within normal limit, for example, if less than 50, then you may need to hold more than 2 days. You should resume your Eliquis, Xarelto, or Badaxa the day after the procedure if your kidney function is normal. You should delay resuming your Eliquis, Xarelto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should also check with your surgeon or proceduralist, make sure you are safe to resume your blood thinner medication. If any difference, you need to talk to your doctor who manages your blood thinner medication or your anticoagulator. If you have any question, concern, please let me know in the comment box below. Thank you. Liver biopsy. What to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, given your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before the procedure. Follow your doctor who manages your warfarin or the anticoagulator closely to you have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lower injection If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take the Lovenol injection, you need to follow your doctor who manage your warfarin or the anticoag instructions closely. Make sure you understand when you need to start the Lovenol injection, when you need to stop the Lovenol injection right before the procedure, when you need to resume your Lovenol injection after the procedure, when you need to completely stop the Lovenol injection therapy. If you are taking Eliquis or Xarelto or Badaxa, you should check your kidney labs to make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Eliquis, Xarelto, Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume the blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulation so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication, please let me know in the comment box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a blood thinner medication, such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, I will recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you may need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 2 days, you consider reaching with the Lovenol injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the low injection, you should follow the doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start the low injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the low injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you may need to wait. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum patient. If any different, you should check on doctor who manage your platinum patient for the anticoagulant. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum patient, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hold for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider reaching with the low injection if you have a recurrent blood clot or stroke history, and you have strong risk factor of having blood clot or stroke, then you need to treat with low injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the low and no reaching. You should follow the instruction closely to understand when you need to stop the low and no injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the low and no injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you may need to hold more than 2 days, and you may need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, you need to discuss with your doctor who manages for platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a platinum medication like warfarin, Eliquis, Xarelto, Badaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved or you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan reach with a low and no injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to push with the low and no injection, you should follow the instruction from your doctor who manage your warfarin or the anticoagulant to make sure you understand when to start the low enough injection, when you need to stop for the procedure, when you should resume your low enough injection. If you are taking the Eliquis, Xarelto, or Badaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. If you have normal kidney function, then you might need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum patient or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Xarelto, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manages your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question, concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR. Come back in 1 week to see if your INR improve, or you can plan surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week, make sure your INR improve, so you can plan for it. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need a bridge with a low enough infection. Your doctor who manage your platinum medication, warfarin, the anticoagulation, will give you separate instruction. Make sure you understand when you should start the low injection, when you need to stop right before procedure, when you need to resume after the you should follow the instruction closely. If you are taking Eliquis, Yeroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume 1 day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking the platinum, such as warfarin, Eliquis, Yeroto, or Badaxa. If you are taking warfarin, you should recheck your I9 about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your INR result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improved, so you can plan for the procedure. And if your INR improved, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a low injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to proceed with the Lovenox injection, it should give you a separate instruction when you need to start your Lovenox, when you stop before the procedure, when you should resume your Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Pradaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Pradaxa. So, your doctors who manage your Eliquis, Xarelto, or Pradaxa, or the anticoagulation will give you the complete instruction when you need to hold Eliquis, Xarelto, or Pradaxa, and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Pradaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manages your warfarin or anticoagulation, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin for the anticoagulant. If you are taking the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. Your doctor who manages your blood thinner medication or your anticoagulant will give you complete instruction when to stop to resume Eliquis, Xarelto, or Badaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your blood thinner medication, you need to discuss that with your doctor, manage your blood thinner medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking blood thinner medication or when you're taking blood thinner medication? Do not hold your blood thinner medication unless otherwise as instructed. For warfarin, you should test your INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR not therapeutic, then you may need to restart the cycle. If you take Eliquis, Xarelto, Badaxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, you should report to proceduralist or the anticoagulant. Cardioversion. What to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. Typically, you must be on blood thinner medication before they came to cardioversion procedure. And do not hold your blood thinner medication prior and after cardioversion. You must test your, if you're taking warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. and then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If you are not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, your INR is supposed to be therapeutic. If not, if your INR too low, they may need to reach you with a lobanol injection. For the Eliquis, Xarelto, or Badaxa, you have to continue taking this medication. If you miss any dose, you need to report to the procedure list or your anticoagulation or the doctor who made the warfarin or platinum medication. So generally, you should not hold your platinum medication before and after the cardioversion, always or with after. If you miss any dose, you should let your doctor know, the surgeon or proceduralist or the anticoagulation, so they have to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other platinum medication, Eliquis, Xarelto, or Badaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INR history, or if your INR history is stable for a long time, then you should recheck your INR about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You might need to be bridged with a lobanol injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with lobanol injection, and you need to follow your doctor who managed your warfarin or the anticoagulant. Make sure you understand when to start the lobanol injection and when to stop right before the procedure, and when you can resume the lobanol injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis Geroto Adaxa patient, they may need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac surgery. If they have unstable kidney function or chronic kidney disease and their creatinine clearance less than 50, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to delay resuming the Eliquis Geroto Adaxa. So, the doctor who managed your Eliquis Geroto Adaxa or the anticoagulant will give you specific direction or instruction on your Eliquis Geroto Adaxa and when to resume. But you should check with your surgeon or proceduralist to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or proceduralist may delay to resume the platinum medication. Please let me know if you have any question in the comment box below. Thank you. Hello. What should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Geroto, or Adaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection off warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then need to adjust the dose and recheck in 1 week if needed. or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the lobenol injection for breaching, then you should follow your doctor who manage your warfarin for the anticoagulation. Make sure you understand when to start the lobenol injection and when to stop before the procedure, when to resume the lobenol after the procedure. If you are taking Eliquis, Xarelto, or Pradaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Pradaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your Eliquis, Xarelto, or Pradaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Pradaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically you resume Eliquis, Xarelto, or Pradaxa 1 day after the procedure. But if you have kidney problems, then you might need to resume your Eliquis, Xarelto, or Pradaxa 2 days or more. So you need to follow your doctor who manage your warfarin for your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hold for your Eliquis, Xarelto, or Pradaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. What should you do a dental caps procedure? You don't have to hold your blood thinner medication prior to the dental cap procedure. That's by your doctor who managed your blood thinner medication or anticoagulant. If you are taking warfarin and you don't have a stable in our history and you have a critical INR recently, and you might need to check your INR prior to. And unless your dental oral surgeon know that you have critical INR recently, if you have any active bleeding, you know to make sure everything's safe. They don't do it now beside the dental caps. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for platinum medication or the anticoagulation or recommendation. If you have to hold your warfarin, follow your doctor or the anticoagulation instruction. If you have to hold your Eliquis, Xylitol, or Bedaxa, then may need 1 day prior needed. Again, you need to discuss for doctor any recommendation. If you have to hold your warfarin or Eliquis, Xylitol, or Bedaxa, you need to check dental when you platinum. If they don't have any instruction, idea when you need to, then you need to consult with your doctor, manage your platinum patient or your hypoid for the instruction. You have no active bleed, they might let you resume the platinum medication same day. Right, so prior to a dental caps procedure, you don't have to hold for platinum medication unless otherwise it's instructed. Check your INR if needed. Critical INR recently or INR history not stable. You have active. You should let your dental or healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that for platinum medication. Okay, if you have any further questions, please let know in for the dental cleaning procedure. What you need to do prior to dental cleaning procedure, if you are taking platinum medication like warfarin, Eliquis, Xylitol, Bedaxa, so I would recommend that you should not hold a platinum medication for a routine dental cleaning. If your INR, if you're taking warfarin, you need to make sure you are stable with your INR level. You don't have critical INR before routine cleaning. If you have critical INR, probably you need to hold your warfarin for a few days in order to get your INR to the therapeutic level. So avoid you just have the critical INR like over 5 or your INR over 6, or you have any active bleeding with patient. Yeah, cleaning. If you have to have a deep cleaning on the platinum medication, to warfarin, you need to check with your doctor who manage your blood thinner medication. They have to review your iron history, and then they will give you some recommendation based on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. If your iron, if your iron is not stable and has the history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Eliquis, Yeroto, but that's and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day prior to deep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, and then you have a good history of your iron therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding, or if you don't have any instruction from your dental when to resume your warfarin, then your doctor who manages warfarin might have you to resume your warfarin after the procedure. But you need to double check if you are safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you are taking the blood thinner medication, please let me know the comment below. Thank you. Bye. Hey, prior to a dental grounds procedure, what should you do if you are on blood thinner medication? If warfarin, Eliquis, Yeroto, Badaxa, I would recommend should not hold any blood thinner medication by this procedure. Otherwise, as instructed by your doctor who manage your warfarin or blood thinner medication or typhoid. You should check your iron warfarin if you have a critical iron recently. If your iron history not stable, you have active bleeding like blood in urine, stool, puff up with blood, stomach bleeding, nose bleeding, things like that, then you need to let your dental know that you have
some concern with your eating. Excuse me. And then you might need to make sure your iron not too high prior to avoid any major bleeding. Sometimes your dental may find something that may want to do additional procedure, then will cause a problem. They're not aware of critical iron or actively that if they want you to hold your open prior to dental brows procedure, then you need to discuss with your doctor who manages your warfarin or other blood thinner medication, or you need to discuss with anticoagulant sure you have the instruction. And then if they want you to hold your Eliquis, your Roto or Badaxa prior to the procedure, for this procedure you may need to only hold patient for a day prior to the. Again, you need to talk to your doctor who manages your Eliquis, your Roto or Badaxa, or talk to your anticoagulant for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, then you need to discuss with your doctor who blood thinner medication or the anticoagulant. Generally, if you don't have any bleeding after the procedure, right, resume the blood thinner medication on the same day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. Right to the dental extraction procedure, you are taking anticoagulant like warfarin, Eliquis, or Roto. You should know what to do prior to dental extraction. If a simple extraction, like one tooth extraction, I would recommend not hold any blood thinner medication. But I would recommend test your iron prior to the procedure if you are not stable. If your iron you have a lot of iron out range, especially higher your upper range. You should check your iron prior to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold from 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists, they may tell you one iron between 2 and, or they want iron less than 2 prior to the procedure. Then you will let your doctor who manages your warfarin know that your iron expect to be at certain level prior to the procedure. One iron day 20 within 24 hours of the procedure. So if depend if you are in excuse me, if you are in not stable or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve
the INR goal expect to be within 24 hours. So, for example, if your INR like 3.5, 2 weeks prior to the procedure, right? So, I would recommend, you need to hold your warfarin 1 day prior to the procedure, and then you need to detach the INR the day of procedure. So, to make sure your INR at 2.3, 2 to 3, that what your dentist want. If your dentist want your INR less than 2 prior to the procedure, then you might need to hold for 3 days. If your INR, were 3.5, 2 weeks prior to the procedure, then you hold 3 days prior to the procedure to make sure your INR less than 2. So it still depends on what your dentist want or expect your INR level or goal for the procedure. If you have to hold your INR, hold your warfarin for 5 days prior to the procedure, okay? Sometimes they have difficult or multiple tooth extraction. They may want 5 days prior to the procedure. They done 1.5, and you need to hold your warfarin might be for 5 days or more, depending on your INR level. So you have to follow your doctor closely to make sure don't have any help needed. So if you have to hold your warfarin for 5 days to get the INR at less than 1.5, then you may need to be breached with the low-knob injection or inoxaparin injection to avoid, the blood clot or stroke, because you take warfarin to prevent the blood clot or stroke. And then if you require to breach with the low-knob injection, then there is instruction, when to start the low-knob and when to resume low-knob injection. You have to follow the doctor who manage your warfarin. If you take Eliquis, Xarelto, or Badaxa, it's easier than prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquis, Xarelto, or Badaxa, but for multiple tooth extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be breached with the low-knob injection when you hold less than 3 days. I think generally it's safe. It's safe for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If the you have to hold your warfarin or the aliquid Yeroto, but that's then resume your platinum medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that's a simple extraction or multiple tool extraction. If simple extraction, you may not need to hold your platinum medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your I9 level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take an aliquid, Yeroto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. And then you should resume your platinum medication as instructed by your dental. And if you have to follow your doctor who managed your work, make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and stop the Lovenox. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on platinum medication, such as warfarin, aliquid, Yeroto, or Badaxa? You don't have to hold your platinum medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who managed your warfarin or your anticoagulate or your dental or your oral surgeon. Okay. If you have a unstable INR history, then you may consider to recheck your INR. If you have a critical INR recently, then you should check your INR, make sure your INR is not too high, right? The procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do. They need to postpone the procedure. This procedure because you have bleeding, you are not too high. But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold the warfarin, and you need to follow your doctor who managed the platinum medication or the anticoagulate. And if they require you, if you're taking the aliquid, your auto by that time, and they require you to hold your platinum medication, okay, prior to the procedure, you have to hold that medication that you resume your platinum medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manage your blood thinner medication or the anticoagulant, when you should resume blood thinner medication. If you don't have any kind of bleeding after the procedure, then might resume the blood thinner medication the day after the, or even same day of the procedure, you have no bleeding done. All right, so again, before a dental fillings procedure, you don't have to hold any blood thinner medication. That's otherwise as instructed. And then you don't have any stable iron history, critical iron recently, then check your anatomy, the bleeding risk procedure. And I just say for the fillings, you should not worry about iron history bleeding, but they have live threatening and bleeding, probably do anything at the hospital eye. They so patient push your bleeding back to normal. All right, if you have any further question or concern prior to a dental, please let me know in the comment. Thank you. Before a dental root canal procedure, what should you do if you are on blood thinner medication, such as warfarin, Eliquis, Xarelto, Pradaxa? I would recommend you should not hold your blood thinner medication. Otherwise, as instructed by your doctor or your anticoagulant. If you have unstable iron history, your recent iron was critical, too high, then you should check your iron prior to the procedure to make sure you are safe from the procedure. If your iron is therapeutic or you have history of stable iron, good iron history, then you don't have to hold your warfarin prior to, unless otherwise as instructed by your doctor who manages your warfarin or the anticoagulant. Or if your dental or your oral surgeon recommend that you hold your blood thinner medication, then you need to discuss with your doctor who manages your warfarin or the anticoagulant to make sure that you hold your blood thinner medication appropriately. So if you have unstable iron history or your iron was critical recently, you should check your iron, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulant clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may require you to hold your or your toe by that time. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the iron level they want before a procedure. And then if you require to hold your Eliquis, Erotor, or Bedaxa, then I would recommend you should go for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Erotor, or Bedaxa, then you need to resume your blood thinner medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, then you need to check with your doctor who manages your warfarin or your anticoagulant to see if they have any. If you have any further question or concern prior to a dental root canal procedure, please let me know in the comments below. Prior to dental, so what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Erotor, Bedaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manages your warfarin, within clinic who manages your warfarin, or your clinic who manages Eliquis, Erotor, or Bedaxa. If you are taking warfarin and you have unstable iron history, then you need to check your iron to make sure you are not critical prior to a procedure. So if you have a critical iron, you should hold your warfarin until your iron back to the therapeutic level or below your range, be safe for the procedure. If you are stable with your warfarin and you have a good iron history by in range for a long time, then you may not hold your blood thinner your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your blood thinner medication prior to dental scaling. If you have to hold your blood thinner medication prior to the procedure, as instructed by your dental, then you need to resume your blood thinner medication instructed. Make sure have a bleeding can control your blood clot and stool. If you take too long to boom for blood thinner medication. So that's the only way you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on blood thinner medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anticoag clinics, make sure they have a recommendation, safe procedure. Again, I would not recommend take blood thinner medication before a dental scaling procedure unless otherwise as instructed by your dental. If you are not stable, if your warfarin doses, you have unstable INA history, and really, and you should talk to your doctor or your anti-coag clinic. Make sure that they give you good instruction what to do with your blood thinner medication prior to that. And then after the procedure, you resume your blood thinner medication as instructed by your dental. You don't have any instruction if they don't know what to recommend, then you should follow your doctor or your anti-coag clinic recommendation. Safe. Resume your blood thinner medication appropriately. If you have any further question or concern about before following procedure, what you do, and you are blood thinner medication. Thank you. Prior to a total knee replacement surgery, so what should you do if you are on blood thinner medication? If you are taking warfarin, then your doctor who manage warfarin for the formulary clinic, they might reject your INA about 2 weeks prior to the procedure. Depend your INA result or your INA history. Then if it's too high, then they adjust your warfarin dose, then have you to back in 1 week. And then if you are getting better or get into the range, then they might hold on for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or recurrent stroke, then they might need to bridge you with the Lovenox injection. And so when they have to push you with the Lovenox injection, they need to make sure you have up to 2 days kidney labs, within 3 months of your kidney lab, and then your current weight in order to dose Lovenox. So there are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or make sure you reach the Lovenox injection. And then a quick Gerotobadexa. Your doctor, excuse me, your doctor who managed your blood thinner medication for the anticoagulant might check your kidney function. They need to update the labs as needed, usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you should need to hold for like 2 days prior to your total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your pH screening clearance, and they recommend that you might need to hold more than 2 days. So if you have bad kidney function, then you might go 3 days off, depending on your
And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your yellow turbidixa days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your platinum medication. So generally, for warfarin, you may resume your warfarin the day after procedure if okay with the surgeon. And then for the Aliquid, yes, the same thing, but you need to resume this medication. If you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid yellow turbidixa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulation who manage your platinum medication and your surgeon or a proceduralist. Have any further questions or concerns, let me know in those.
Hello, young. This is a very good question. A lot of people ask the question when I handle manage the comedy clinic. Yes, some people have to take both work and aspirin. But not a lot of people. Some people have to take wolf and aspirin. Aspirin generally for the certain B bases but they don't have additional factors. So they only need to take aspirin. But when they have additional factors like over 75 or have diabetes. So that two score over 2, they should take the anticoagulant instead of take only aspirin. Some people have to take and warfarin because additional condition. For example, who take a warfarin, the IV, and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take 1 year also. Some people have to take the other antibiotics. So, depending on your medical history, your doctor or your pharmacist whether or not you should take both aspirin or warfarin. Thank you for your. If you have any other further question, please let. Thank you. I am still. This is another good question. I think generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but you need to check with the heart doctor to make sure they are okay for that. Hello, Yajit. This is a good question. What is the difference between Motrin and Tylenol? I say Motrin is a non-inflammatory steroid drug. So it's used for mostly for inflammation pain, like aches or muscle pain, muscle cramps. Whereas Tylenol is used for non-inflammation and like my headache, my fever, or my pectin. But just pay attention on all the side effects for each of these medications so you profit. So Motrin may affect your stomach like ulceration when you use very high dose or you take it in empty stomach. So and then it might affect your kidney also. So when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. And Tylenol may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if disease. You should consider heavily when you're taking Tylenol. And when drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. So those this is very important to consider when you should take Tylenol or Motrin. That's pretty much what's different between Tylenol and Motrin. If you have any further questions, please comment below. Let me know. Thank you. Hi, friend. Is it good? question. Basically, this is a general question I used to have. Typically, it's no, we should not take Modrin while we are on warfarin. Because Modrin is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin, or Eliquis, Yeroto, any type of anticoagulant. We should not take Modrin. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Modrin. All right, so next medication is warfarin, Coumadin. So when you should not take warfarin, you should not take warfarin if not recommended by your doctor or pharmacist. Okay, if there is no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, pure fibrillation, or AFib. This is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. Did not start warfarin if you have active or significant or major bleeding. You should discuss with your doctor or your pharmacist to make sure they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you ask your doctor and your pharmacist to have active bleeding or you have a history of major bleeding. Warfarin. And if you have been taking warfarin and you should have the active bleeding that you need to report to the doctor, they stop it. And if you have life-threatening bleeding, then you open right away and go to the emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Eliquis, Yeroto, Redaxa. They are blood thinner medication. You should complicated medication. If you are about switching from warfarin to Eliquis or switching from the other blood thinner medication to warfarin, then there may be some overlap for a few days. For example, if you switching from Eliquis warfarin, then you need to overlap the Eliquis and warfarin for 3 days, or you stop the Eliquis. Make sure warfarin start working in your body after 3 days, like that, but not taken together in a daily basis.
control your prevent your blood flow. And when you or you are new to warfarin and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the antiplatelet like Plavix or aspirin. You need to check to make sure you still need to take Plavix or aspirin. And if you have been taking and if you've been taking warfarin, then they just start a Plavix or aspirin, then you need to let them know you're on warfarin. Make sure, you know, the Plavix or aspirin they want to start, you need it. Sometimes it's not. Sometimes they don't know if you are on warfarin or platinum medication. It just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin, but they have different indications. To make sure you don't have to take the medication that not take prevent recycle. You should not take warfarin if you're allergic. And then and for the warfarin, 4 to 5 days prior to the major procedure, colonoscopy, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, presuming that, presume that that your INA level is at the therapeutic level. And if your INA level, at the supra-therapeutic or out range, then we'll have hold your INA, hold your warfarin accordingly. Because that is different topic, very complicated. And then, after the procedure, then you ask the surgeon or the proceduralist, make sure that if it's okay to resume the warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend the patient to check with the surgeon or the doctor who will perform the procedure, make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room, just bleeding, like medication. And when you taking the warfarin, then what medication you should avoid. Check with your doctor or pharmacist. Every time you have a new medication, including over-the-counter herbals, vitamins, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both affect warfarin and affect your body. You check with your doctor and when you have any kind of bleeding,
need to report to the doctor. Or even you just have abnormal bruising, check your doctor. You might have too much warfarin in your body, or you might have heck or eat any food that increase iron or increase bleeding. Just make sure you report it. And pay attention, and sometimes they switch you to a new blood thinner medication, Alaquix, Geronto, then I need to stop warfarin. When you start the new blood thinner medication, Alaquix. Make sure that you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or after warfarin. Have any further questions or clarify anything? Please let me. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But yes, you can do that. But if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take Tylenol. It affect your liver, and then it may cause bleeding. You alcohol, drinking alcohol. You should not take any like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol, check it with liver function. And then 4,000 milligrams a day. You do so, it might affect your dose. Take a day. So Tylenol, if you don't have any problems, if you're not alcohol, and if you are blood thinner like warfarin or extra, it's for you to take compared to all the pain. And last one is you should not take Tylenol. Be very important Tylenol when and take to make sure you are protected All right. So let me know. Thank you. All right. So the next medication, is fish oil, omega-3. So the omega-3 for fish oil, you can buy over the counter, and it's generally safe to take. But I would recommend that you should check with your doctor to make sure you take it correctly. Okay? And I would not fish oil if it being expired. You should make sure that it's not expired, so you take a good product. If it's expired, it might cause problems. When it's expired, it's no longer effective like it should, but it increase side effect, like bleeding or cramps, nausea, things like that. The main side effect or bad taste, bad smell. It might contain harmful bacteria. When it's expired, it might leaking or broken. You may experience some bacteria. Some research indicate that it may lead to increased risk of cancer. Expire. Make sure you check the expiration day and take it correctly. Also, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or if you have after you take fish oil, you have bleeding, or you have any kind of dark or hairy stool, then you may need to start taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you are taking warfarin and having critical or elevated iron level. If you have iron level about 5, very dangerous. When you take fish oil, it increase risk of bleeding. And you should not take the fish oil you taking other blood thinner medication like Aliquid, Eroto, Adaxa, or the antiplatelet like aspirin or have bleeding or low hemoglobin. Those factors very important to consider whether or not you should continue taking fish oil or start the fish oil. If you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligrams a day without clear indication. Now, if somebody have some sort of increased cholesterol, and they might take about 10 milligrams a day. But if you take more than that, and you don't have any clear indication or recommendation, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 grams of fish oil a day. And do not take fish oil if you're allergic to it. Okay? It's very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I recommend you should check with your doctor and your pharmacist if you have any active bleeding, or if you platinum medication are safe from bleeding. And not take this medication when it is, and then when your iron is very high, like critical level or elevated, just stop taking this oil, or do not start or eat supplement. All right, if you have any question about this over-the-counters, this medication, please let me know the comment. Right, next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But, yes, you can do that, but if you don't have any additional medical condition, or if don't know how much you take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, your liver. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver, like active hepatitis, or liver disease. So you should not Tylenol without checking with your doctor. Affect your liver function. Do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe if you don't have any problems drinking too much. And if you are blood medication like warfarin or Aliquid, Pradaxa, it's okay for you to take Tylenol. It's safe to take compared to all the pain relief medication. Okay, so and then the last one is should not take Tylenol if you are allergic to it. So, the very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So that medication, Motrin. This is also available over the counter at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter, or can get prescription from your doctor. But you should not take Motrin or ibuprofen if it's not recommended by your doctor or person. And not take the Motrin if you are on empty stomach. The food in stomach might cause problem or bleeding. So make sure you eat before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So major stomach problem like peptic ulcer or gastric problems, or heartburn, or GI bleeding or stomach bleeding, blood in urine, or kidney problems. You have the kidney dysfunction or renal problems. You need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. If you are taking warfarin, blood thinner medication like warfarin, Eliquis, Xarelto, or Badaxa, etc., you should not start the Motrin or ibuprofen. Headache or back pain or toothache, things like that. You might try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Eliquis or any blood thinner medication. So, and if you taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you a new blood thinner medication like warfarin or Eliquis or Badaxa. You should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. If you take more than that, it might cause very serious side effects like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take ibuprofen if you're allergic to it. This very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen, pay attention to this information. Very, very important. If you don't follow the recommendation from your doctor or pharmacist, you may have problem with medication. Most of people have stomach ulceration that they didn't take the medication correctly. They take on their empty stomach. That easily cause stomach ulceration. And it may damage your kidney. You take too much Motrin, like overdose of, or more than 4,000 milligrams a day. And you may have some kind of bleeding, maybe ventric bleeding, when you take with warfarin or Eliquis or any other platinum medication. All right, so this excuse me, this is very important information. I hope that you should pay attention of this information before you start or stop the medication. The Motrin you may take as needed. You don't have to take it every day. Just take as needed for your pain. And this is the non-formulary steroid medication. The non-steroid infusion, NSAID, they call NSAID. Usually, Motrin, they take something for your swelling pain. When you get your toothache and you have swelling gum, or you have back pain because the swelling or inflammation of your back, commercial strength, something like that, Motrin may help a lot compared to Tylenol. You know, if you are taking a platinum medication, then avoid Motrin, with bleeding, and it may affect your kidney function. All right, thank you. So, do not take aspirin if not recommended by your doctor or pharmacist. So, for this medication, it has some serious side effects. So, you should not take it if it's not recommended by your doctor. Number two, if there is no clear symbol, a clear indication, including, take aspirin for your heart, for your atrial fibrillation, or for stent, protect the blood clot due to stent. It's just, excuse me. So I would recommend that you should check to see if you have any clear indication for your aspirin. Number three, do not take aspirin if you have any active bleeding, like GI bleed or stomach bleed, nose bleed, or blood in the urine. So any active bleeding should hold your aspirin. And of course, talk to your doctor or your pharmacist if they have any further recommendation. If you are taking like warfarin, Eliquis, also you need to make sure that the aspirin, usually the baby aspirin, while you on the warfarin or Eliquis or any type of anticoagulant, or even the antiplatelet like Plavix. So these medications have the coagulation effect. So make sure you check with your doctor or pharmacist to make sure if you are required to take aspirin while you're on a blood thinner medication or not. Or if you are taking the baby aspirin or the regular dose aspirin, the 325 milligram aspirin, then you need to talk to the doctor who give you a new blood thinner medication, like warfarin or Eliquis. Talk to them to see if you have to continue the aspirin while they start you blood thinner medication, warfarin. And do not take aspirin if you're allergic to it. They have some kind of that reaction. It's very dangerous. So these are very important information for you to know that why you should not take the aspirin or why you should not continue to take aspirin when you have a new medication such as new blood thinner medication like warfarin, Eliquis, or Adaxa, or Plavix. All right, so any question, concern about this topic, please let me know. Thank you. So the last part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say a C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply. So no law talking about the quantity maybe dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 months supply. But like I say, most insurance companies limit for 90-day supply for prescription only medication. And then some medication, it's very dangerous to spend over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum, like medication like a Seroquel or Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medications, they might not give you more than 90-day supply. That is the basic safety, not about insurance, not about the money. That is the safety. Most of the pharmacists or the doctor, they don't feel comfortable they're gonna comfortable to dispense more than 90. For the refill, there's no specific set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription. Or, the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial fill is permitted, however, the total amount or quantity in all partial fillings must not exceed total amounts prescribed for prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days were issued from any insurance company and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid. Insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. But the old pharmacy cannot transfer your expired prescription, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the date of the prescription were issued, and then the day supply, the prescriber or the doctor one, and then some prescription, they, like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes. Those disease, those medical conditions, a chronic medical condition require you to take for a long time, and you might request 90 days. And then accept that request from you. You don't have to ask your doctor for that, and ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor's office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the psycho problems, and you need to see the psychiatrist before you get the prescription filled. Or some medication required to monitor your blood, like coumadin, to get the lab blood test draw before they can renew your prescription, like that. You need to work with your doctor. The pharmacy cannot help you with those things. And within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, and the pharmacist can call to a new pharmacy to get the prescription transfer. But after we do that, the prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. From C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your local pharmacy to see how they call the Schedule 6 control substance prescription. Sometimes they call the RX only prescription, some prescription or regular. If you have any further question or any, I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. That we do your prescription. Thank you. Have a good one. I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions or C5 prescriptions. Again, you need to understand the day supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying, how many they supply. I need anything, any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. it's not like C free and C prescription. It limit to 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture field. So there is no law regulating fracture field for C5 prescription. But the total amount of all fracture filling but not exceed the total amounts required. And when the prescription expires, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 prescription, C3 and C4 prescriptions. Then, the prescription may be just valid for up to 6 months. It were issued. So it still depends on your states. Okay. But if your state had no specific or set time for expiration, then the prescription might be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient understand, why they give you certain day supply, and usually for those states who have no regulation on the C5 prescription, then they might fill up to 90-day supply. It's just like regular prescription medication due to 90-day supply. But if it consider C5 prescription as the C3 and C4, then it may only give you 30-day supply. And again, check your state regulation to see if you can refill the prescription beyond the 6-month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. You let me know if you have any questions for the Schedule 5 controlled substances prescription or C5 prescription. Thank you. There you go. Schedule 3 and 4 prescription. So again, the day supply, or state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30 days supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34-day supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation. 4 times 6 months is equal to 24. Probably you have 4 refills if 34-day supply. For box refill, if the pharmacies are unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. This C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity in all box refillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a box refill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So these really basic but important information both patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier. If the patient wants to get the prescription too early, they only do 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then some a lot of patients, they don't understand this why the pharmacist refill to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining. And the pharmacist, I mean, the healthcare insurance might have some information. For example, if you the prescription multiple pharmacy, uh, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. Good Friday, everyone. I would like to talk about pharmacy law today. A lot of patients and some feel about every day, especially retail pharmacists and people who work at the chain pharmacy like CVS, Walgreens, Walmart. They face with the pharmacy law every day. So I would like to talk some important pharmacy laws that might be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, hydrocodone, morphine, those medications controlled substance Schedule 2 or C2 prescription. So first I would like to discuss about day supply. Okay. So excuse me. So the day supply of C2 prescription, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication can be 60 days supply. And some injectable infusion medication during the bumps, they might be okay for 90 days supply. So for these day supply limit is a different and vary state to state. So you may need to check with your state law to see what are the supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling. 或 Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock. So they are out of stock medication. And in that case, the pharmacist might give you some partial fill. But it's very complicated to do the partial fill. Pharmacists need to spend the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the partial fill. And then it's not permitted the patient request. The patient cannot request a partial fill. The partial fill only occur if the pharmacy does not have enough medication in stock. So how long the prescription, the Schedule 2 prescription is valid? Depend on state. Some state